Okay, pulmonary embolism. We've talked about this a little bit, but basically pulmonary embolism is when a blood clot goes to your lungs. So it's got to go through the right side of the heart. It usually comes up from the venous system, goes into the right part of the heart, it goes into the lungs, and it causes problems there. If it works and can get out of the lungs, that clot, then it goes to the left side of the heart, and you have a very high risk of then having a stroke. So pulmonary embolism can be life-threatening. It can cause death. Predisposing factors: patients that are on prolonged bed rest, post-surgical procedures, obesity, risk for pregnancy for having the DVTs, supplemental estrogen, especially if you're smoking, go hand in hand, birth control, oral birth control, and smoking, and a family history. There are some very strange genetic issues that predispose people to having blood clots, so that could be part of that as well. 90% of clots form in the deep vein, others in your pelvic veins, right side of the heart. If a patient has right heart failure or right ventricular hypertrophy, that would also be a risk for that. Remember, patients that have atrial fib or atrial flutter are also at a high risk of forming clots, so those could go straight to the brain as well. So dyspnea, signs and symptoms. Dyspnea is the most common. Tachypnea is very frequent. Patients that have these and survive say it's a sudden onset of chest pain, pleuritic in nature, meaning it hurts more when you breathe in. It may feel like an MI, so a patient who's never had one might think they're having an MI. Fear, impending doom, sweating, patients can go into shock. A very bad sign, doesn't happen with all patients, but a very bad sign would be hemoptysis. So these patients need oxygen now. You need to sit them up, high Fowlers. If they survive it, they need to be on bed rest and IV heparin so they don't form any more clots. Find out where the clots are coming from. So perhaps do a Doppler on the legs to see if there's any more. If the patient's on heparin, you don't want to give them any aspirin. If they haven't recently had surgery or other contraindications, then the patient can have streptokinase, TPN, Retaplase, something like that. Not all patients can receive that though. So medical procedures, we can actually put a filter in your vena cava if they have lots of clots in their leg, or if they have a coagulation disease that's causing clots. So on discharge, these patients are probably going to be on some Coumadin or Lovenox for a period of time. They should be very compliant. They shouldn't be taking aspirin. You need to monitor the signs of bleeding if they're taking anticoagulants. Don't want them bleeding other places. So a fat embolism. A fat embolism can go to your lungs and your brain. This usually happens with severe trauma of large bones like your femur and your tibia. So basically these fat emboli go into the lungs, cause the same kind of problem that a clot would form, and that could cause a problem. It can also cause pulmonary edema. Another thing is these little fat emboli can go all over the place and cause petechiae. So kind of the same thing with a patient that has micro clots from endocarditis. It's very similar. Could go to the brain, could go to the lungs. So how do we treat that? Well, steroids, pulmonary support if they have one. Watch symptoms of somebody having a attack in the brain. Pulmonary edema. Pulmonary edema is basically usually brought on by heart failure, or too much IV fluid for a patient that has heart failure even, or a patient that has hypoalbuminemia. That can also be causing it as well. Inhaled toxins, certain toxins can cause it. Near drowning, severe hypoxemia, high altitude. Pulmonary edema happens with patients, some people that climb Mount Everest or K2, other things like that. Pulmonary edema is a life-threatening medical emergency. The fluid comes pouring out of the lungs. They need oxygen. They need Lasix. They're going to have a hard time breathing. So they need to get that fluid off quickly. So diuretics are the number one treatment. Bronchodilators, digitalis, morphine. Morphine will help your preload. It'll reduce your preload. So different things like that will help. But it is life-threatening